Good afternoon, ladies and gentlemen, and welcome to this afternoon's SADA webinar aimed at educating and empowering members of the public. My name is Dr. Tinesha Parbu, and today I have the pleasure of hosting Dr. Odirile Moloi, who will be presenting on the topic of dental abscesses. Dr. Moloi completed his dental degree at the University of Limpopo, and he then did his community service at the South African Military Health Services, where he developed a keen interest in endodontics, which is root canal treatment, and aesthetic dentistry. He has been in private practice since 2007 and is based in Louis Pasteur Hospital in Pretoria Central. His main field of interest is endodontics, and he has also recently completed his postgraduate diploma in endodontics. He is a key opinion leader for Dentsply Sirona, and he also often gives lectures in endodontics. We also have a bit of a TV star on our hands here. He has appeared in numerous TV adverts for Colgate Palmolive, and continues to do oral health interviews on local TV and radio stations. And in his spare time, I believe he enjoys collecting vinyl records, camping, hiking, and exploring mountain bike trails. So, with no further ado, I'm going to hand you over to Dr. Moloi.
Doc, thank you so much for having me. What an introduction. So, Doc, today we're discussing a very interesting topic. We're discussing, most of the time in our practices or in the hospitals, we get a lot of dental patients coming in complaining of a dental abscess. And as you'd have it, we have a lot of patients that go on Google Doctor, social media with, it has helped many of our patients. Also, it has not helped many of our patients because sometimes it gives wrong information, wrong perception, and other things. But obviously, we have to deal with that idea of having modern consumers, our patients being able to go onto social media and checking things out. But I hope with what we're going to have a discussion about today will bring a lot of light to our patients, a little bit of understanding, more understanding, and sort of taking their dental IQ a notch up, making them understand what's going on in their mouth and how and where they should seek help. So to start with, my patients always ask me, what is a dental abscess? How do I describe it? So in an easier way to put it, a dental abscess would be a collection of pus. When pus forms inside a tooth, we would then have a dental abscess or at the apex of the tooth, at the tip of the tooth. And many of the patients don't even pick it up that they do have one because it's not prominent yet. But some would come to you with a huge swelling or swollen lymph nodes or a lot of pain or any other of those symptoms. Or patients would definitely complain of pain. So why dental abscesses and how we can solve such situations? So we have a lot of bacteria that can manifest inside your tooth. And how does that happen? When you get tooth decay, we have a few different stages of tooth decay when your tooth decays. Firstly, it would affect the enamel of your tooth, and that's when a dentist will just maybe do a preventive measure or do a normal restoration. Sometimes the decay spreads into the dentine of the tooth and find its way to the pulp. Now, where the pulp of the tooth is where the nerves are, where the life of the tooth is. You find nerves, you find blood vessels, you find a lot of other things that keep our teeth alive, vital, and in function. So there are different reasons why one would develop an abscess. Could be decay, tooth decay, could be from trauma when somebody hit the tooth, sports contact or any of those, contact sports things. Or it can also be from a cracked tooth. Let's say somebody's grinding their teeth and they start having bruxism and the tooth gets cracked, then an abscess can develop because now the tooth are dying off. So you get different causes of this, but most commonly we find it when decay spreads all the way into the pulp. Now, when that happens, sometimes the patient doesn't seek help immediately. They would delay, they would see it, and they would come when it's really bad. Or sometimes we pick it up during a routine dental checkup. And sometimes as well, when the patient is complaining of pain on the tooth, you find that it has reached, the decay has spread through the enamel, through the dentine, and now it finds its way into the pulp. Now, when we come across a situation like that, We would usually, a dentist would do some diagnosis, like do pulp sensibility test, that when they check if your tooth is sensitive to cold, to hot, or to touching, we do things like that. We call them pulp sensibility tests. We also take x-rays, which are very important in any dental consultation. And with an x-ray, we can be able to pick up if the tooth is decayed and how far the decay is. We can also use CBCT, which is more advanced form of scanning the teeth. But with a normal x-ray, you'll still be able to see the decay penetrating through the enamel, dentine, and into the pulp. And sometimes you are able to see at the root of the tooth, around the root. We call it periradicular or periapical because it's around the root of the tooth or around the apex of the tooth. We find this lesion that shows that there is some form of disease, there is bacteria that's going in there. And when you get a situation like that, that's when you have to explain to the patient. And I always say, let us always afford patients the different treatment modalities. As much as I'm a dentist that loves endodontics or root canal treatment, I always have to suggest other treatments to my patients, give them other options so that they can make an informed decision, be it because of cost, be it because of what they want as a patient or what they're comfortable with. Then it's what we do. So in a situation like that, even if it's what the patient wants, sometimes even if that's what the patient wants, it can be done. Let's say, for example, you get a patient with a severely cracked tooth and they say, no, I know you can do a root canal treatment and save my tooth. I've got the money, I've got everything you want. But if the prognosis or the rate of success is very poor, we won't do root canal, we would opt for extracting the tooth. So we always say to the patient, there are options like a root canal treatment, options like an extraction of a tooth where you remove the tooth and later plan to replace it with any different form of replacement. Or you can say to the patient, let's wait until the symptoms become, the patient can tell you, I want to wait until the symptoms become severe, or I want to go for a second opinion. Those are still treatment options that are available to our patients. Now, if a patient opts to do root canal treatment, which is what I enjoy doing, we would then have to go into the tooth. We have to clean. Remember, the cause of the abscess is either bacteria or trauma. If it's trauma, sometimes it doesn't mean the tooth is infected. It doesn't mean the tooth will have an abscess. It's just there was an accident, patient fell, patient was hit with a ball, or an accident happened, a trauma happened, and we need to prevent the tooth from being infected, or we need to find a way to build up the tooth, so we have to go inside the pulp system. Or we do it because there's an infection. When there's an infection, then the dentist will advise you on that root canal treatment. And usually, how does root canal treatment, how is it performed? To be honest though, I get a lot of patients who are misinformed with root canal treatment. Patients go on YouTube, on TikTok, and everywhere, and I don't blame them. But I always enjoy explaining to my patients and clarifying how dental treatments are painless, because we give local anesthetic when we suspect that you're going to feel any discomfort during treatment. And I can assure you, no dentist wants to work on a patient where they're feeling pain. So if there's still pain, the dentist will increase the dose of the local anesthetic until at a point where it's working and we are comfortable to work in the mouth. And root canal treatment has gone so advanced over the years. Many people have done them a long time ago. Now, recently, with modern dentistry, a lot of improvement has happened in terms of how the root canal treatment is done itself. Now, we go into the tooth, we open the space inside the tooth, go into the pulp chamber, and follow the root canal space, clean it, disinfect it, and shape it. After we've shaped it and we are sure that we have cleaned it comfortably, where there are different ways to clean, to shape, and to disinfect. After we've done that, we fill the root canal space. We fill the tooth with a very strong filling material. Sometimes we have to crown the tooth or build a core with a post, sort of like something that will help hold the crown better, help strengthen the success of your tooth. So that would be root canal treatment. Sometimes the patient would opt for removing the tooth. Sometimes the patient would opt for getting a second opinion or to wait until there are more definitive symptoms on the tooth. And I always tell my patients, the last option is the only one that can be painful. When you're still delaying and procrastinating, that is the only painful option. The rest of these options are pain-free and they are solution-driven. They are there to solve your problem. Now, with root canal treatment, I always explain the pros and cons to my patients I always ask for permission or consent, if you call it, just like in any other dental treatment. You always have to get permission to the patient, explain it to them in a language they can understand, and start the process and explain to them the success rates, the treatment estimate or the treatment cost, and how it can vary from dentist to dentist or from tooth to tooth or from procedure patient to patient. It can vary based on the situation inside. Yeah. So dental abscesses, doc, are not the end of it. And patients come to us with less hope, thinking, no, it's over. I'm going to lose my tooth, or it's going to be so bad. My aunt once died while they had an abscess and they were treating a tooth. I get that all the time. And it's up to us to teach our patients all of that. And also, there are some medication that we give the patients to augment the treatment that we've done. And sometimes, Doc, I forgot to mention a very important point, that root canal procedures are usually done in one visit, but you get other instances where we have to see a patient more than once because of the amount of tooth infection or the difficulty of the root canal or the complexity of the anatomy of that tooth. Yeah.
Thank you so much for that wonderful summary. I think it's a great overview, really, of what your options are if you suspect that you have an abscess. If I could perhaps just ask one question. I remember when I was in practice, there was a lot of patients who used to insist that antibiotics was necessary in all cases because they were convinced they had an abscess. So perhaps you could just give us your view on that.
So you realize that as I was explaining everything, I mentioned medication to augment the procedure only at the end, because it's not in every case that one would prescribe. And I find that many of my patients love antibiotics. Patient could come to me for a tooth filling and say, Doc, it's so painful, I think I need antibiotics. So patients love the idea of antibiotics, and also it's because of the misinformation. But antibiotics are only prescribed if the infection, let's say you have a dental abscess and we can see it's evident, then we give antibiotics, or sometimes we give them to prevent the abscess from forming. Excuse me, because sometimes it does happen that the abscess was in the process of forming. That's why sometimes you get those instances where a patient comes to you today with a very painful tooth. There's no sign of an abscess. You treat the patient. Tomorrow, the patient wakes up swollen and they say, because I went to the dentist, I came back swollen. So I always advise my patients and say, hey, there is a possibility that when you leave here, there can be some swelling because there was a cascade of events. It was already coming to form. What I'm trying to do is I'm trying to arrest it and stop it from taking place, but sometimes it was going to form. Then we give antibiotics. But not every case of root canal needs antibiotic. Not every case of root canal needs more than one visit as well.
Okay. Fantastic. Thank you so much for your time today and for providing us with this vital information. It seems that we don't have any questions, so I'm going to sign off now and enjoy the rest of the afternoon.
If there's any questions, they can leave it on our comment section. We can always come back and respond to that. And thank you to Sarah for having me. Thank you, Doc, for having me.
Thank you.